Good morning, everyone. This is Dr. Susan Mara with Dr. Mara's Medical Minutes. And today we're going to talk about the prevalence of neurodegenerative disorders such as Parkinson's disease, ALS, um, frontotemporal dementia, Alzheimer's disease, etc., and their relationship to tick-borne infection. Alan McDonald several years ago documented in the autopsy of, I believe, 6 patient brains. Every one of them the patients died of quote unquote Alzheimer's disease, and every one of them he found spirochetes. So there's a huge amount of debate as to whether or not Lyme disease and Bartonella and Babesia and etc. are the cause of neurodegenerative disorders like Parkinson's, Alzheimer's, ALS. And in 25 years of practice, I can tell you that in my practice, they're 100% correlated. However, you have to remember that I attract a certain kind of patient just by the law of attraction. So those people suspect that they had a tick bite, or they know they had a tick bite, and that's how they get to my office. There's a lot of other people who go to environmental medicine doctors because they've gotten exposed to chemicals and pesticides and um, diesel fumes and things like that. And those people also have neurodegenerative disorders. The question is do they also have tick-borne illness that hasn't been identified? I don't think there's a answer to this yet. My gut tells me, though, just from life, just from the wisdom of life, that there are many roads to Oz. It's not just the yellow brick road. The yellow brick road happens to be the most highly traveled, but that's not the only way there. So I suspect that the neurodegenerative disorders such as Lewy Body Dementia, Parkinson's, ALS, Alzheimer's disease, I suspect that those disorders also have other etiologies that involve exposure to chemicals, which causes neuroinflammation and immune dysregulation and limbic system dysfunction, which we know is very prevalent in these neurodegenerative diseases. I think that you should absolutely be checked for tick-borne illness. Start with Lyme, and then if you come back positive for that, then check the other ones. But I suspect that there might be some people that don't have tick-borne illness, and they had a really bad chemical exposure that caused the brain to become on fire. Neuroinflammation is the brain on fire. And I think that there's many roads to the brain on fire. So what I would say to patients with neurodegenerative disease is you should probably get checked for Lyme with a Lyme literate doctor and rule that out. Because if it is infectious etiology, the treatment's going to look very, very different than if it's a chemical exposure, and it might be both. So infectious etiology of neurodegenerative disorders is obviously going to require probably an integrated medicine approach, modification of diet, immune support, detox, lowering inflammation, a whole host of things, tweaking the endocrine system, and in order to get these people into a better place. So I hope this information has helped you, and I hope you have a wonderful day.